Our next witness wishes to be known as Kerri, does she?
She does.
Kerri, please.
Please state your full name.
Kerri Hudson.
Take the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth. Thanks.
Kerri, you're here to tell us about your mum, Maureen.
Yes.
We've also had a statement from your father, and you're going to be referring to information from that as we go through your evidence as well.
Yes.
Your mum and dad married in 1967,
Yes.
when your mum was 31.
Mm-hmm.
Your brother arrived 2 years later, and you arrived 2 years after that.
Yeah.
And your dad has described that your mum was his best friend and his whole world.
Yes.
And you also had a very close relationship with your mum.
Yeah, we all did. We had a great family life. Yeah, very close.
Your mum had a subtotal thyroidectomy in 1990, but didn't require a blood transfusion during that operation.
No.
And apart from that, your mum was in excellent health till 1994.
That's correct, yeah.
She led an active, outdoorsy kind of life.
Very much so, yeah. We went on camping holidays and stuff when we was kids. Every year, really. Yeah, went skiing when we was younger as well, so very active, yeah.
She loved being out in her garden.
Yeah, out in our garden, taking the dog for long walks, kept ducks and chickens in the garden. Yeah, very active.
In 1994, your mum had a hysterectomy.
Yeah.
And during the procedure, she was given 2 units of blood.
Yeah.
Was your mum asked to consent to that transfusion?
Not that I recall, no.
And as far as you're aware, as far as your dad's been able to say as well,
Yeah.
was she given any warning as to any possible risks involved in having the transfusion?
No, none whatsoever.
And what's your understanding of whether your mum needed that transfusion?
How I understand it, because she only had 1 or 2 units of blood, that it would have taken her a longer time to recover. However, she could have done without those units of blood.
Your dad says that actually they weren't even told at the time that she'd had the transfusion.
No, it wasn't after the operation. Yes, that she didn't get told after the operation. It was only afterwards that we then got her medical records that she realised that she'd had the units of blood.
And that at that stage, looking back, the family were told that she could have managed perfectly well without it.
That's correct.
It just speeded up her recovery slightly.
Yep.
After the hysterectomy, your mum seemed to be doing pretty well, recovering pretty well until the September.
Yes.
And what did you notice in the September?
In September, I came back from holiday. My mum and dad collected me from the airport. My mum had stayed in the car. Once I got in the car, my mum turned around, and my dad had said that mum hadn't been very well, but didn't really go into great detail. When I got in the car, she turned around and looked at me, and I would never forget what she looked like. She was extremely yellow and looked horrific.
We have a letter from that time which sets out your mum's symptoms. 0998 please, Henry. And it says this: as far as the surgery is concerned, she's coped very well. She tells me that since a week she's been very jaundiced and suffered from nausea and vomiting. There's no history of foreign travel, alcohol or contact with jaundice. She had 2 units of blood transfused 6 weeks ago with the operation. There's been no abdominal pain. She feels well in herself, but she complained of dark urine and light stools. And then further down, clinically, she obviously has hepatocellular jaundice with some obstructive element. I've sent her for some blood tests, hepatitis A, B and C, clotting factors, UNEs and LFTs, and repeated the liver function test along with a liver ultrasound scan. That was in the September, and in the following February, a letter from Dr. Richardson sets out the results of those tests. Could we have 0998006, please? And if we can zoom into the main body of the letter. Thank you, Henry. There have been 1 or 2 serological developments in your patient who had a hepatitis-like illness in the autumn. We now find that she has antibodies to hepatitis C. She's made a complete recovery from her clinical hepatitis, which I thought was consistent with hepatitis A. But of course she did have a blood transfusion in August last year. The excitement now, of course, is to find out whether the donor of the blood is suffering from hepatitis C. It's not for me to say what patients can get up to on holidays in Malta, as hepatitis C can be acquired sexually or via an infected blood transfusion. You will recall that she was under Mrs. Wilson's care in September 1994 when she had a hysterectomy at St Margaret's. At that time, in 1995, your parents weren't aware of this letter, but you obtained it later.
Yes.
And they saw it. What was their reaction to the letter?
Absolutely disgusted. And obviously when I saw it, I was myself, my mum and dad, been married 40, 50 years. If anyone knows my mum, to have ever thought she could be having other sexual activities elsewhere is just absurd.
And in fact, that
sickens
holiday...
me, really. Every time I read that letter, as I've been doing the statement for this, it just... really, sickens me.
And your father in his statement
Yeah.
makes similar comments because the holiday to Malta was a holiday that your mum and dad had gone on together.
Together as...
And the suggestion that there had been other sexual activity on that holiday outraged him as well.
It's absurd.
It does start with the words, "It is not for me to say." Has
Indeed.
Dr. Richardson been asked why then he said it?
Unfortunately,
I would like to
When
ask that
Dr.
myself.
when we sought to trace Dr. Richardson, it became apparent that he had passed away. There is also, you also object to the comment in the letter, the excitement now.
Yeah, I don't really see what excitement there is to find out whether she's got hepatitis C. It's just a strange letter to me from a educated doctor to another doctor. But
At this stage, in February 1995, when this letter was written, your parents didn't see it, and in fact they weren't aware that your mum had hepatitis C.
No.
She was informed shortly afterwards when she went to the Royal Free Hospital.
Yes.
And your father's recollection of her referral to the Royal Free was that at that point, that was the first time she was told she had hepatitis C in early 1995, and she was given very full information about the nature of it and the risks of transmission.
Yeah.
Does that accord with what you understood had happened at that appointment?
As I remember, yeah.
But at that point, there was no explanation of how she'd contracted the hepatitis C.
No.
Your mum had been working as an auxiliary nurse at this point, but she felt unable to continue in that role. Why was that?
Well, she had been told that she got hepatitis C. The hospital that actually gave her the infected blood was where she returned back to work as a nurse in auxiliary and maternity ward. They knew she had hepatitis C, but still allowed her to carry on working there. But obviously, after some time, became very tired, and she was doing nights, and she couldn't manage to carry on working there.
So she found an office job instead.
Yeah, local. It just was right near where we lived. She just worked there for a couple of mornings a week, I think it was. Yeah, it was just office-based work.
Then in March 1997, your mum had a liver biopsy. What did that show?
That showed, as I remember, raised ALTs, and that she did have hepatitis C and psoriasis. Small. I think it was a small element of psoriasis on her liver.
And in 1998, she was reviewed at the Royal Free, and the letter after that appointment, so in 1998, the letter after that appointment summarised her situation.
Yeah.
And you think this was the first time that the how she'd contracted hepatitis C was explained to her.
That's
in
correct.
1998.
Yeah.
So if we have a look at that letter, 0998004, please, Henry. And it's the main body of the letter starts at the bottom. I reviewed this lady in Professor DeShako's clinic on the 9th of July 1998. She's an ex-auxiliary nurse who acquired hepatitis C from a screened blood transfusion. I gather from Dr. Gorman at the Blood Transfusion Centre that the unit of blood received was negative for anti-hepatitis C. However, subsequent investigations have revealed that the donor was PCR positive for HCV RNA and has subsequently undergone seroconversion to anti-HCV positive status. The blood transfusion have clearly followed national guidance, and it's most unfortunate that Mrs. Drain acquired hepatitis C. I discussed with Mrs. Drain the diagnosis of hepatitis C and antiviral therapy using interferon, and we discussed at length the potential side effects of this drug, the commonest symptoms being flu-like symptoms and depression. It's an immunostimulatory drug, so it can cause autoimmune problems. And there's then a note about her previous thyroid problems, and then a note that she was keen to start antiviral therapy. But until this appointment in 1998, your mum had not had any clarity as to how she'd contracted hepatitis C, and it was really just a mystery to her.
Yes, that's correct, yeah.
Your mum did have treatment
Yeah.
in 1998, but she had to go to the Royal Free rather than your local hospital.
That's correct.
Why was that?
The local hospital said that they didn't have enough funding to give her the treatment.
And what was the effect on your mum of having to travel to the Royal Free?
It was from door to door, probably a 2-hour journey. And obviously when she wasn't, at first obviously it was, she sort of could cope with it, but then obviously as it was going on, we was getting the train, taxis, going to the Royal Free Hospital, you go up several flights of stairs. She was determined to do that, didn't want to be doing the lift because she didn't want to give in to it. It was very exhausting for her.
And you were going with her for most of
I
those
probably
appointments?
went on a majority of her appointments that she went, and went through the whole procedure of the side effects of all the treatment that she was going to have.
And what was the effect of the treatment on your mum?
They did give a whole massive list of side effects. Maybe looking back at it now, well, she was extremely tired. I think there were occasions of depression, but then I'm not sure because she also had ascites where she was then rather had a large stomach, so she obviously got quite depressed about that because she looked 8 or 9 months pregnant, so she sort of struggled with that. I can't think of what other side effect. I think that was probably it, really.
Your dad said in his statement that she became really very depressed.
Yeah.
And the main impact was on her mental state.
Yeah.
Was she offered any counselling or psychological support?
None whatsoever. No.
A few years later, you said in your statement that your mum started suffering from pedalodemia and, as you said, abdominal swelling.
Yeah.
And she was advised to restrict her fluid intake.
Yeah, they told her to reduce her salt intake, and just to not drink as much like water, fluid. Yeah.
And you've described that your mum became too weak to do a lot of things.
Yeah, as I had previously said, so she wouldn't be taking the dog for a walk. She would be fairly housebound. Doing anything was a real struggle and hard work for her. Yeah.
And she became much more socially isolated as well.
Yeah, with the abdominal swelling, she always needed to be near a toilet. So it was difficult for her to go anywhere too far for too long.
In 2011, it was found that your mum had chronic liver disease and was cirrhotic.
Yeah.
And in 2012, she underwent a liver transplant.
Yeah.
She was very unwell after that transplant.
Yeah.
What can you tell us about that?
She got called in once before for the liver transplant, but then the liver wasn't suitable for her. She then got called in the second time on the 2nd of August and had the liver transplant then. She probably was in hospital, it was a bit of a blur, I think it was probably about 6 months she was in there on and off. Probably the tablets that she was on for the anti-rejection tablets and loads of other tablets that she had to have was then affecting her kidney. I then had a conversation with Dr. Patch, the consultant, after probably about a month or 6 weeks after the operation, and he really said it was not looking good. So they had to take a risk and change the tablets and take her off of the water tablets. And she then started to pick up, but it was a long process.
The transplant was complicated by rejection,
Yeah,
a bile leak,
Yeah.
and recurrent ascites.
Yeah.
Just before the transplant, you applied to the Skipton Fund
Yeah.
on your mum's behalf.
Mm-hmm.
What happened to that application?
It got refused because they said that she got contracted hepatitis C after the September 91 cut-off point, and sad as it is that you've missed the date, it's gone past it.
We have a copy of that letter, 0998-007, please. It's the first 2 paragraphs. I'm writing to inform you with regret of the ineligibility of your application for an ex gratia payment under the scheme that Skipton Fund is administering on behalf of the Department of Health and the equivalent departments. The Skipton Fund was set up by the Department of Health to provide ex gratia payments to people who were thought to have been infected with hepatitis C as a result of receiving treatment with NHS blood or blood products prior to September 1991. From the information we've received regarding your claim, it appears that the treatment your doctor thinks may have been the source of your infection was during hysterectomy in 1994, which would fall outside of the remit of the scheme. You were then advised to apply to the Hepatitis C Trust. What happened with that application?
That also got rejected, but I'm just going to go back onto that, which I've just, as you're reading it out, where they're saying from the information we've received regarding your claim, it appears, and that your doctor thinks. It's not appears, and it doesn't, that the doctor thinks. It is in a written letter that she contracted hepatitis C from the blood transfusion. There's no question about that. So I do find that frustrating. But
Because your doctors had provided the information required on the
Yeah,
form and been
we
very
gave them a
clear
copy of that
that's when
letter.
it was.
yeah, there's no appears or thinks. It's guaranteed. That's how it is. But the Hep C Trust as well, as I remember, we got rejected too. And the only reason I tried to claim anything from either 2 funds was to just try and make things life a bit easier for my mum, of just getting around and different things. But
You'd wanted to do some adaptations to your parents' house to accommodate your mum's difficulties.
would have helped, yeah.
And to mean that she wouldn't have to keep working as much. Or at all.
Financially they had no support, and she was getting very tired, and then it was down to my dad, who he felt he had to just go out and just go to work to keep things going, yeah.
You wrote to your mum's MP and she pursued the matter and received a reply from Anne Milton, the Parliamentary Under-Secretary of State for Public Health at the time.
Yeah.
And again, we've got her reply, 0998 998008, please. And it's the second and third paragraph. It's page 4 of the document, please. I was sorry to hear that Mrs. Drain has hepatitis C. However, as you're aware, the Skipton Fund was established specifically to make payments to people infected through their treatment with NHS-supplied blood or blood products before the advent of screening blood donations for hepatitis C, which was introduced in the UK in September 1991. As your constituent has confirmed in her correspondence that Mrs. Drain contracted hepatitis C in 1994, this would make her ineligible to a payment from the Skipton Fund. If Ms. Hudson wishes to take this issue further, I'd suggest that in the first instance she seeks legal advice in relation to clinical negligence. You also applied for disability allowance.
Yep.
And that was refused.
Yep. I only probably did that in the last 6 months, I'd imagine, of her life, yeah.
And the only thing you managed to obtain for your mum was a blue parking badge.
Yep.
But when did that arrive?
That arrived a week after she passed away.
So
And she had to, however, even still looking 9 months pregnant and very difficult to get her into the upstairs of the library and then come back down the stairs to then walk outside to prove that she needed the badge. But yeah, she then got that only a week after she passed away.
So throughout her illness,
She had nothing.
so you,
And I only did that claim because I tried to stress to her that it would make life a little bit easier for her, because she was always dead against making any claim at any time, because she felt the NHS was struggling as they was, and she worked for the NHS at some point.
your mum had had the transplant in 2012 but deteriorated over the years.
Yeah.
And she died in September 2018.
Yeah.
Can you tell us something of the effect of that on you?
Yeah, massive effect. Yeah, in different circumstances, I could stand here all day and speak about my mum. She was a best friend. She was always there. We probably never had crossword all our life, really. Yeah, I can't. Yeah, I miss her badly.
You've said that she'd become very dependent on you, your
Yeah.
father, your brother, and that you tried to always stay strong, for the most part succeeded in looking as though you were coping well, but inside you would be crumbling.
Yeah, because we've got 2 children, and she was a great grandmother to them. And yeah, it's been hard.
You feel completely lost without her.
Yeah,
And you say you've lost your trust in doctors and hospitals.
massively. Currently, at the moment, is actually in hospital. Hannah has been for the last 4 weeks. And even then, I'm questioning everything they're doing and why they're not doing it quick enough. Yeah, it does make you very, what's the word? Just not believing in them at all, really, which is not really great. Yeah.
Your dad's now also, we won't go into the details of what's wrong with him, but you
Yeah.
feel that because of your mum's death.
Yeah, I do, definitely. He can't, cope. Yeah.
And he struggled to cope at all with his loss.
Yeah, he's found it extremely hard. When my mum wasn't very well, I think he was tried to blinker it and thinking that she was quite a strong lady. and that she would carry on and he would never have to face up to losing her. But yeah, now he has. It's finding it very hard.
Those are the questions I have for you. I'm just going to turn to Mr. Collins,
Okay.
who, as you know, represents you. He has nothing further he would like me to raise. Is there anything else you would like to say?
No, I don't think so. No.
Sir.
You've given us a tale of the frustrations you had dealing with officialdom of its various forms. And then at the end of your evidence, you said, in answer to a question, that you felt you were crumbling inside.
Yeah.
And I think we could see some of that in the way that you gave your evidence and showed how much everything has affected you.
Yeah.
Which makes it all the more remarkable that you were prepared to come and tell us about it. And
Yeah,
thank you very much for that.
I will just say that obviously when we was called up to do this, my mum was still alive, and I did ask Nina, my solicitor, that what happens if she does pass away? Can I still carry on and do this? And she said yes. And my mum actually said to me that she wanted to carry on and fight for this, just to just so no one else has to go through this, when this should have all been sorted and it should have been tested blood. It shouldn't have ever been given to her. Yeah. And I would do anything to have her back.
Well, thank you very much.
Thank you.
We'll take a break then until tomorrow morning, 10 o'clock. And what do we have in store tomorrow?
We'll be hearing from Martin MacLeod, Carol Carruthers, an anonymous witness, and then Michael O'Driscoll.
Thank you. Tomorrow, 10 o'clock.